Good day, Ma'am Sheila. We are the Group 2A and we are going to present to you our case study on hyperthyroidism. To begin with, here is Ms. Escalicas for the objectives.
For the general objectives, this case study aims to broaden the students' knowledge regarding hyperthyroidism, and it is designed to develop and enhance the skills and attitude in the application of different nursing processes and management of the patient with hyperthyroidism. For the specific objectives, number one, to be able to acquire knowledge regarding hyperthyroidism, its background and epidemiology through research, to recognize the contributing risk factors and signs and symptoms associated in the development of hyperthyroidism, to understand the anatomical and physiological structures involved together with its pathophysiology, to formulate a comprehensive nursing care plan in the care for the patient with hyperthyroidism, to require the knowledge on the role of drug therapy and medical and nursing management, to learn the nursing implications and prioritize responsibility to improve patients' condition, to provide recommendations to ensure the continuity of the nursing care management, to provide health teaching about hyperthyroidism. For the introduction, hyperthyroidism, also called as overactive thyroid, is a condition where your thyroid makes and releases high levels of thyroid hormone. This condition can make your metabolism speed up. Symptoms of hyperthyroidism include rapid heartbeat, weight loss, increased appetite, and anxiety. Hyperthyroidism can be treated by anti-thyroid drugs, radioactive iodine, beta blockers, and surgery. Hyperthyroidism is a condition in which your thyroid creates and releases more hormones than you need. This is also called overreactive thyroid. The main hormones your thyroid makes include triiodothyronine and thyroxine. For the epidemiology, hyperthyroidism is more common in women than men. The overall prevalence of hyperthyroidism, which is approximately 1.3%, increases to the 4 to 5% in older women. Hyperthyroidism is also more common in smokers. Now, for the anatomy and physiology.
For the anatomy and physiology, thyroid gland. It generates hormones that control heart, muscular, and digestive function, as well as the brain growth and bone upkeep. Its proper functioning is dependent on a sufficient quantity of iodine in the diet. Next. For the hypothalamus and pituitary gland. The thyroid gland is controlled by the hypothalamus and pituitary gland, which are located in the brain. The thyrotropin-releasing hormone, or the TRH, is released by the hypothalamus, which stimulates the pituitary gland to release the thyroid-stimulating hormone, or the TSH. Next. For the pathophysiology, the overproduction of T4 and T3, or both, is the cause of hyperthyroidism. The treatment of the underlying causes of an overactive thyroid, as well as the diagnosis of the condition, can alleviate symptoms and prevent problems. Excess iodine, thyroiditis, toxic adenomas, and other cancers, toxic multinodular goiter, and excessive levels of tetraiodothyronine acquired from dietary supplements are all causes of hyperthyroidism. Thyroid hormones enhance basal metabolic rate by stimulating a variety of metabolic activities in most tissues. Higher body heat production is one of the effects of this activity, which appears to be due, at least in part, to increased oxygen consumptions and ATP hydrolysis rates. The effect of thyroid hormones can be compared to blowing on a smoldering fire. The sympathetic nervous system uses spinal nerves to connect the internal organs to the brain. When stimulated, these nerves increase the heart rate, increase blood flow to the muscles, and decrease blood flow to the skin, preparing the body for stress. It is possible to explain changes in cardiac output, cardiac contractility, blood pressure, vascular resistance, and rhythm abnormalities caused by thyroid function by studying the cellular processes of thyroid hormone action on the heart and cardiovascular system. Hyperthyroidism causes an increase in cholesterol excretion and a decrease in LDL turnover, resulting in a decrease in total and LDL cholesterol, but no change in HDL. Thyroid hormone's effect on lipoprotein is currently being contested as both decreases and no changes have been recorded. Protein catabolism or breakdown outnumbers protein synthesis, causing tissues to lose protein quicker than it can be supplied. When an individual is under physical or emotional stress, famine, or an extremely low calorie diet, or when the quality of protein is inadequate, a negative nitrogen balance can arise. For example, when the diet is lacking essential amino acids. And during time of stress, adrenal cortical chemicals such as cortisone increase protein breakdown and the conversion of amino acids to glucose. And now,
For the patient profile, we have patient EFG as our patient, female, 40 years old, birthday November 5, 1982, birthplace Navotas, civil status married, address Valenzuela, nationality Filipino, religion Roman Catholic, educational attainment high school graduate, date of admission December 20, 2020. Time of admission is 3 o'clock a.m. For the admitting diagnosis, hyperthyroidism, and for the shift complaint, palpitation, fatigue, and body weakness. Next slide. Next slide. For the history of present illness, 1 week prior to admission, EFG had complained of changes in bowel frequency and her menstrual cycles. She is disturbed by her goiter, feel like there's consistent phlegm upon gulping. Protruding of the eyeballs, increased appetite but still does not gain weight. For all these symptoms and ailments, she still has not consulted a physician regarding her disease. Few hours prior to confinement, above symptoms are now associated with palpitation, fatigability, sweating, bowels of diarrhea, warm moist, warm moist skin, lid extraction, and body weakness seen by the doctor in the clinic, hence referral to Valenzuela Medical Center after being diagnosed with hyperthyroidism. Next slide. For the history of past illness, the patient has been hospitalized at the age of 16 years old due to a urinary tract infection. When EFG was at the 19th of age, she was confirmed pregnant for the first time and had a checkup at a nearby hospital in Navotas. Upon medical laboratory scan, it revealed that it was a stillbirth. Another sequence of laboratory were ordered, done, and her physician explained hyperthyroidism is the reason why her first pregnancy failed. Thus, the diagnosis of hyperthyroidism had been made. She has been prescribed propylthiouracil, tapazole, and metoprolol at the age of 20. She underwent X-ray and ECG as follow-up laboratory checkup and revealed an enlarged heart as a result of hyperthyroidism. Next slide. For the family history, hypertension, diabetic mellitus in her mother's side, PTB, and cancer at father's side. Next slide. For the physical assessment,
For the physical assessment, first is vital signs, The temperature is 38.5 degrees Celsius. The pulse rate is 107 beats per minute. And for the oxygen saturation is 98%. And for the respiratory rate is 21 cycle per minute. And for the blood pressure is 110/70 millimeter of mercury. And for the neck circumferences is 12.5 inches. And for the head is have headache and fatigue. And for the eyes is protruding of the eyeballs and lid extraction. And for the mouth is pale mucous membrane. And for the neck is goiter and difficulty in swallowing. And for the heart is palpitations. And for the skin is sweating and warm moist skin. Next. And here is Miss Ira to discuss of the course in the ward.
For the course in the ward, date December 20, 2020, 3 a.m., admission of the patient to the female ward of Valenzuela Medical Center. Per doctor's order, hook to PLR 1 liter at 125 cc per hour. Then for the laboratories is UBC with platelet count, T3, T4, TSH, sodium, calcium, potassium, urinalysis, CXR. For the nursing responsibilities, monitor vital signs every 4 hours, monitor T3, T4, TSH, and calcium. Watch out for complications. Next, please. For the medications, profilitoracil 50 mg tab per every 8 hours. Propanolol 10 mg every 4 hours. Potassium 250 mg tab PID. Diazepam Valium 5 mg PO every 6 hours PRN. Paracetamol Biogesic 500 milligrams 1 tab PO for fever. At 11 a.m., PLR 3x with drop factor of 20.
And for Gordon's functional pattern, first is health perception and health management. Prior to admission, the patient occasionally drinks alcohol, does not smoke, and denies using drugs. She has no other medical history and takes no medication. During hospitalization, follow the doctor's order and take medications. The patient participated very cooperatively with the healthcare providers whenever it was time to take her vital signs and her medications. Next, please. For nutritional and metabolic pattern, according to the patient, she increased appetite but still does not gain weight. During hospitalization, the patient eating plenty of a low iodine diet helps to reduce thyroid hormones. Next, please. For elimination pattern, prior to admission, according to the patient, she said she urinates more often during the daytime and nighttime, including diarrhea. During hospitalization, she's been monitored for the development of frequent bowel movements, and she only walks when there's a need to use a restroom. Next, please. For activity exercise pattern prior to admission, according to the patient, she did not usually do activities due to fatigue. During hospitalization, the patient can do some light activity every 30 minutes, such as sitting, standing, and walking around with help of a family member. Next, please. For sleep rest pattern, the patient did not sleep through the night because of having insomnia. During hospitalization, the patient can now sleep properly due to avoiding having a heavy meal, and the right bedroom temperature is key, such as 15.6 to 19.4 degrees Celsius. Next, please. For cognitive perceptual pattern prior to admission, according to the patient, she does not have any problems with her hearing as well as her memory, but she is experiencing protruding of the eyeballs during hospitalizations due to a combination of artificial tears, including drops or gel to relieve dry eyes, and medication has shown to be effective in reducing protruding of the eyeballs. Next, please. And for the self-perception or self-concept pattern, prior to admission, the patient loves to socialize since according husband to the husband of the patient, her wife gets along with her neighborhood pretty well. During hospitalization, the patient's friend and children are still visiting her and making sure to check her condition. Next, please. And for the raw relationship pattern, prior to admission, the patient lives in Valenzuela City together with her husband and children. The patient is also a sweet and loving wife. During hospitalization, due to patient's condition, her husband was taking care of her. Next, please. For sexual reproductive pattern, prior to admission, the patient is married and has a decreased libido. During hospitalization, due to conditions of patient, they cannot perform sexual intercourse anymore. Next, please. And for the coping and stress tolerance prior to admission, according to the patient, she is suffering and experiencing too much stress. And for the during hospitalization, the patient stated that she watches television with her family in her hospital room to prevent herself from overthinking and feeling anxious. Next, please. And for the last is value and belief pattern. Prior to admission, the client is a Roman Catholic, but her family rarely goes to church every Sunday. During hospitalization, she never blames God for her current condition. Her relationship with God became strong. And here is Miss Palomar to discuss the drug study.
For our drug study, the first medication is propyltyrosine, and the brand name is propyltyrosine therapeutic. Classification is anti-thyroid agent. Pharmacology class is thiamides, dosage 50 mg, frequency TID, route of administration PO. The mechanism of action is it works by inhibiting thyroid hormone production, making it beneficial in the treatment of hyperthyroidism. It works by blocking thyroid peroxidase, an enzyme that converts iodide to an iodine molecule into the amino acid tyrosine. The indication is patients with grave disease, hyperthyroidism, or toxic multinodular goiter who are intolerant to metimazole and who are not candidates for surgery or radioactive iodine treatment. Individuals who are intolerant to metimazole, it is used as an adjunct in the treatment of hyperthyroidism in preparation for thyroidectomy or radioactive iodine therapy. The side effects is nausea, vomiting, loss of appetite, loss of hair, headache, sleepiness, dizziness, and joint pain. For the next consideration, hyperthyroidism or thyrotoxicosis symptoms should be monitored or tachycardia, palpitation, nervousness, insomnia, fever, diaphoresis, heat intolerance, tremors, weight loss, diarrhea, and examine the patient for sign of hypothyroidism. Last is examine the patient for a skin rash or swelling, in the lymph nodes of the neck. Next po. Next slide na siguro. Next medication is propranolol hydrochloride. Brand name is Inderal. Classification is antihypertensive. Next. Pharmacology class is non-selective beta blockers. Dosage is 10 mg. Frequency, QID, and route of administration is PO. Mechanism of action. Reduces cardiac oxygen demand by blocking catecholamine induce increase in HR, BP, and force of myocardial contraction. Indication is patients with hypertension. Side effects is dizziness, slow heartbeat, unusual changes in mood, lethargy, and fever. Nursing consideration was drug mask common signs and symptoms of hypoglycemia. Some antihypertensives are less effective in lowering BP when used as monotherapy for Black patients. Propranolol should not be confused with prasugrel or Pravachol. Last is Enderal should not be confused with Isordil, Adderall, or Imer. Ano pala? Next medication is potassium acetate. Therapeutic class is potassium supplement. Pharmacology class, potassium salts. Dosage is 250 mg. Frequency is TID. Mechanism of action is replaces potassium and maintains potassium level. Indication, patient with hypokalemia. Side effects is nausea, vomiting, diarrhea, and abdominal pain. Nursing consideration is monitor ECG and electrolyte levels during therapy. Monitor renal function and adverse reaction may reflect hyperkalemia. Next is count CI. 10 is not to be confused with kaolin. KCI is not to be confused with HCI. Chlorcan is not to be confused with claron, and micro K is not to be confused with macrobid or microbase. Next po. Next medication is diazepam. Brand name is Valium. Therapeutic class is anxiolytics. Pharmacology class is benzodiazepine. Dosage is 5 mg. Frequency is Q6H PRN. Route of administration is PO. Mechanism of actions, benzodiazepine that potentiates the effect of GABA, depresses the CNS and suppresses the spread of seizure activity. Indication, patient with anxiety, seizure disorder, and muscle spasm. Side effect is drowsiness, fatigue, headache, confusion, and nausea. Nursing consideration is monitor LFTS, CBC, and renal function in patient receiving repeated or prolonged therapy. Next is monitor HR, BP, and mental status. Next is patient are at risk of four falls. Last is don't confuse Valium with Valicide. Next medication is paracetamol. The brand name is by Jesse. Therapeutic class is acetaminophen. Pharmacology class is antipyretic, and analgesic. The dosage is 500 mg, frequency QID, route of administration is PO. Mechanism of action is it exhibits analgesic and antipyretic activity by inhibiting prostaglandin synthesis. Analgesia is produced by raising the pain. There's hold, and antipyresis is produced by acting on the hypothalamus heat regulating center. Indication is patient with fever, minor pain, or aches. Side effects is dizziness, allergic reactions, or swelling of face, lips, throat, tongue, and skin rash. Nursing consideration is make sure the patient isn't using any other paracetamol containing medications. Next is patient should be warned not to take any other paracetamol containing drugs. And they should carefully study the labels of all other medication to verify that they do not contain paracetamol. Assure that patient understand that they must not exceed the recommended dose. Last is on an empty stomach, paracetamol can be taken.
So for the diagnostic and laboratory test interpretation, the doctor ordered CBCR complete blood count, clinical chemistry, urinalysis, chest x-ray, and thyroid scan. So for the first day of admission, for the complete blood count, white blood cell or WBC slightly elevated. The result is 12.20. Red blood cell 6.40 slightly elevated. Hemoglobin 18 slightly elevated. Hematocrit 51.80 slightly elevated. Neutrophils 0.7 normal. Lymphocytes 0.4 normal. Monocytes 0.05 normal. Platelet 600 high. Laboratory values shows there is an increase in red blood cell, hemoglobin, and hematocrit in patients with thyroid problems were significantly higher than other control groups. Platelet count was higher than normal, showing dengue signs. Next slide, please. For the clinical chemistry, sodium 140.00 normal, potassium 5.00 normal, fluoride 99.00 normal, creatinine 112 normal, C3 or triiodothyronine 14.6 increase, T4 or thyroxine 210 increase, TSH or thyroid stimulating hormone 0.2 decrease, calcium 3.2 increase, thyroglobulin 43.8 increase, pre-thyroxine 2.46 increase. There is an increase of T3 and T4 as well as calcium, thyroglobulin, and FT4 nodes in the blood. The TSH shows that it has decreased. The pituitary constantly monitors our thyroid hormone levels, and if it senses the slightest excess of thyroid hormone in the blood, it stops producing TSH. Consequently, a low blood TSH strongly suggests that the thyroid is overproducing hormones on its own. Next slide, please. So for the next diagnostic test, for urinalysis, macroscopic and microscopic. For the macroscopic, color or appearance result is yellow, reaction pH 7, specific gravity 1.023, albumin 4.2, glucose 4.2 positive, glucose 25 positive, ketone 0 negative, bile 1.2 negative, urobilinogen 0 negative. For the microscopic, pus cells 5 HPF normal, RBC 2 HPF normal, WBC 4 HPF normal, epithelial cells 16 HPF normal, cast
3 normal, crystals 45, bacteria some, and yeast some. Glycosuria may be detected in patients with hyperthyroidism when the rate of metabolism is markedly increased. There may be marked destruction of vital body tissue, namely protein as shown by the excretion of urinary nitrogen. Next slide, please. For the chest X-ray interpretation, chest X-ray upon admission showing significant cardiomegaly and the right pleural effusion. On the left side result, which is the right side, showing resolution of cardiomegaly and right pleural effusion. Next slide, please. Thyroid scan revealed an increase in size. It also revealed overactive multinodular goiter with cold nodules dominant on the right and focal hot areas on both sides. Next presenter, please.
For the nursing care plan, our first nursing care plan, nursing diagnosis, hyperthermia related to increased metabolic rate, secondary to hyperthyroidism. For the assessment, subjective data, sobrang init ng pakiramdam ko as verbalized by the patient. Objective data, temperature 38.5 degrees Celsius, warm, moist skin, BP 110 over 70 millimeter per mercury, pulse rate 107 beats per minute. For the nursing diagnosis, hyperthermia related to increased metabolic rate secondary to hyperthyroidism as evidenced by elevated body temperature, warm skin, decreased blood pressure, and tachycardia. For the background knowledge, it starts with the increase of the T3, followed by the increased metabolic rate, and it affects surface area, activity levels, sweating, environmental conditions, and it leads to increased body temperature. For the planning, after 3 to 4 hours of nursing interventions, the patient will be able to maintain body temperature below 37.5 degrees Celsius and maintain blood pressure and pulse rate within normal limits. For the nursing interventions, independent, first, we encourage the patient to loosen and remove excess clothing and covers. This is that exposing skin to room air decreases heat and increases evaporative cooling. Second, we provided a tepid bath or sponge bath. This is a non-pharmacologic measure to allow evaporative cooling. Do not use alcohol as it can cool the skin rapidly and may cause shivering. And next, we adjusted and monitored environmental factors like room temperature and bed linens as indicated. Room temperature may be accustomed to near normal body temperature and blankets, and linens may be adjusted as indicated to regulate the patient's temperature. Next is we encourage adequate fluid intake. This is to help lower the body temperature and dehydration. And for our dependent nursing intervention, we administered paracetamol 500 milligrams as prescribed. This is to help reduce fever. For our nursing interventions, the patient was able to maintain body temperature of 37.2 degrees Celsius and maintain normal blood pressure of 120 over 90 millimeter per mercury and pulse rate of 80 beats per minute. Therefore, goal was met. For our nursing care plan, 2, activity intolerance related to fatigue exhaustion secondary to excessive metabolic rate. For the assessment, sobrang subjective data, sobrang nangihina at pakiramdam ko ay pagod na pagod ako kahit nakaupo lang ako as stated by the patient. For the objective data, pulse rate is 107 beats per minute, blood pressure is 110 over 70 millimeter per mercury. For our nursing diagnosis, activity intolerance related to fatigue exhaustion secondary to excessive metabolic rate as evidenced by abnormal blood pressure and pulse rate response to activity, fatigue, and body weakness. For the background knowledge, thyroid hormones stimulate diverse metabolic activities that leads to increase in basal metabolic rate, that leads to initiate lots of energy, that makes body tends to break down, and leads to exhaustion and fatigue. And then there is activity intolerance. For the planning, after 5 to 8 hours of nursing interventions, the patient will be able to participate in prescribed physical activity with normal range and pulse rate and blood pressure as evidenced by blood pressure of 120 over 90 and pulse rate of 70 to 90 beats per minute. Our patient should maintain normal skin color, skin is warm and dry with activity. Demonstrate increased tolerance to activity. For our nursing interventions, for the independent, we minimize cardiovascular deconditioning by positioning the client in an upright position several times daily. This is because positioning in an upright position helps maintain optimal fluid distribution and maintain orthostatic tolerance. Next is we assess the client for the appropriateness of activity, mobilize the client as soon as possible. This is that mobilization is a cost-effective and simple method of maintaining stable cardiovascular parameters such as blood pressure and pulse rate, countering orthostatic intolerance. Next is we monitored and recorded the client's ability to tolerate activity, noted pulse rate, blood pressure, respiratory pattern dyspnea, use of accessory muscles as skin color before, during, and after the activity. This is because development of cardiac decompensation symptoms can cause harm to the client and should be stopped immediately. Next, we allow the periods of rest before and after planned exertions periods, such as meals, baths, treatments, and physical activity. This is to reduce fatigue. And then we instructed the client to stop the activity immediately and report to the healthcare provider if she is experiencing worsened intensity and increased frequency of palpitations, weakness, unusual, and extreme fatigue. This is because pulse rate and arterial blood oxygenation indicate cardiac tolerance. Pulse oximetry identifies hypoxia. And then we educated the client with energy conservation techniques such as sitting to do tasks, frequent position changes, pushing rather than pulling, sliding rather than lifting, and working at an even pace. This is because these techniques reduce oxygen consumption, allowing a more prolonged activity. For our dependent collaborative interventions, we referred the client for physical therapy for strength training and possible weight training to regain strength, increase endurance, and improve balance. This is to assist the client manage activities within individual limits and to promote wellness. For our evaluation, after 7 hours of nursing interventions, the patient was able to participate in prescribed physical activity with normal range in pulse rate and blood pressure as evidenced by 120 over 90 BP and pulse rate of 85 beats per minute, and maintain normal skin color. Skin is warm and dry with activity. She also demonstrated increased tolerance to activity. Therefore, goal was met. For our third nursing care plan, nursing diagnosis is imbalanced nutrition less than body requirements. So for the assessment, our subjective data, kumakain naman ako pero ang payat ko pa rin at hindi nadadagdagan ng timbang ko as verbalized by the patient. For the objective data, she feels like there's consistent phlegm upon gulping. Her height is 164 centimeter, her weight 49 kilograms, and her BMI is 18.2. For our nursing diagnosis, imbalanced nutrition less than body requirements related to intake less than metabolic needs secondary to excessive metabolic rate as evidenced by no weight gain, although appetite has increased considerably. Dysphagia and body weight below ideal range. So for the background knowledge, the increased thyroid hormone may lead to excessive metabolic rate that leads to intestinal hypermotility and then lead to imbalanced nutrition less than body requirement. For the planning, our short term for this is after 2 to 3 hours of nursing interventions, the patient will be able to recognize factors contributing to not gaining weight, identify nutritional requirements, and then identify ways to gain weight. For our long-term goal, after 4 to 6 weeks of nursing interventions, the patient will be able to consume adequate daily nourishment, gain at least 0.5 kilograms per week when thyroid production is under control, and be free of signs of malnutrition. For our nursing interventions, for the independent, advise the client to monitor daily food intake and weigh daily and report losses. This is to continue weight loss in face of adequate caloric intake may indicate failure of anti-thyroid therapy. And then we encourage the client to eat and increase number of meals and snacks using high-calorie foods that are easily digested. This aids in keeping caloric intake high enough to keep up with rapid expenditure of calories caused by the hypermetabolic state. And then we also advise the client to avoid foods that increase peristalsis, such as tea, coffee, fibers, and highly seasoned foods, and fluids that cause diarrhea, like apple and prune juice. So because increased motility of GI or gastrointestinal tract may result in diarrhea and impair absorption of needed nutrients. And then we also considered we advise the patient to consider 6 small nutrient-dense meals instead of having 3 larger meals daily to lessen the feeling of fullness. This is because eating small frequent meals lessens the feeling of fullness and also decreases the stimulus to vomit. And then for our dependent in nursing interventions, we encourage the client to consult with dietitian to provide diet high in calories, protein, carbohydrates, and vitamins. Because she may need assistance to ensure adequate intake of nutrients, identify appropriate supplements. Excuse me. And then we administered medications as indicated, such as glucose and vitamin B complex, because given to meet energy requirements and prevent or correct the hypoglycemia. And next, we referred to a speech therapist for evaluation and instruction for disturbance in swallowing food. Because this adjustment of the thickness and consistency of foods to improve nutritional intake may be provided by a speech therapist. For our evaluation, after short-term goal, after 2 hours of nursing interventions, the patient was able to recognize factors contributing to not gaining weight and then identify nutritional requirements. And then she also identified now ways to gain weight. And therefore, long-term goal, after 6 weeks of nursing interventions, the patient will be able to first consume adequate daily nourishment. And she also gained weight of 5 kilograms. And then free of signs of malnutrition as evidenced by weight of 54 kilograms and BMI of 20.1. Therefore, goal was met. For our discharge planning, here is Ms. Cabobos to continue.
For the discharge planning, medication, anti-thyroid drugs, methimazole, tapazole, or propylthiouracil to block the ability of the thyroid to make hormones. They offer rapid control of your thyroid. For the exercise, patients with hyperthyroidism may especially benefit from good lifting cardiovascular exercise at least 3 times a week, as well as increased bone density from strength training. As hyperthyroidism is treated, exercise can also prevent excess weight gain. It may even help control your appetite. It may be helpful to start off with lower intensity exercise. Walking, yoga, and Tai Chi fall into these categories. It might be worth seeking out a personal trainer with experience helping hyperthyroid clients. For the treatment, radioactive iodine. This treatment may cause thyroid activity to slow enough to be considered underactive. Anti-thyroid medication to reduce the symptoms of hyperthyroidism by preventing your thyroid gland from producing excess amount of hormones. And for the health teaching, educate the patient not to take the thyroid medication at the same time as fiber supplement, calcium iron, multivitamins, or any medication that bind bile. Encourage the patient to keep accurate records of daily weight and intake and output. Instructed the patient to take high fiber rich diet to avoid constipation. Educate the patient about the need to avoid extreme cold temperature. Advise the client to avoid food that increase peristalsis such as tea, coffee, and highly seasoned food and fluid that cause diarrhea, apple and prune juice. For the outpatient, call your healthcare provider right away if you have any of these: anxiety, shakiness, or sleeplessness that gets worse, sore throat while taking medicines to control hyperthyroidism, fever at 104 degree Fahrenheit or higher, shortness of breath, trouble focusing your eyes or double vision, weight loss, fast heartbeat at rest, enlarged thyroid gland, and diarrhea. Follow up with your healthcare provider or as advised. And for the diet, encourage the patient to eat foods rich in calories and protein. Next is encourage to drink plenty of fluid. Encourage the client to eat an increased number of meals and snacks using high-calorie food that are easily digested. And for the spiritual, encourage the family to provide support, emotional and psychological support. Encourage the patient to verbalize fears and complain, and show support for the patient with spiritual coping with their own spiritual tradition.
That ends our case presentation. Thank you very much, Ma'am Sheila, for taking the time to listen. We appreciate the time you have made available to us and for giving us the time allowance. Thank you.